Hello, this is Maran Dali, my anxiety therapist, MD. So today we are going to talk about borderline personality disorder and narcissistic personality disorder. You are hearing a lot about these things in pop culture with Amber Heard, and I know that narcissism is all over TikTok and everywhere. So I wanted to go over some of these things so that you could have a better idea of what you are hearing about. So let's start off with the basics. No, this will not be a science class. I'm just going to go over some basics so you understand. So when we're born, all the parts of our bodies are pretty much done, but our nervous system is pretty basic. So as we come into the world, our caregivers, they give us love, attention, and take care of our needs, our food, our diapers, our rocking, knowing we need to sleep. This helps us grow connections in our nervous system, in our brain. It helps put all the pieces together going into our nervous system. If our caregivers are constantly available, that doesn't mean all the time, but it means we're fairly certain that if we need something and we start to cry, they'll be around, they'll take care of it, they'll know what it is, they're pretty attuned. Then we start to build some connections going, okay, this is safe, I'm good, I know what it is, it gets taken care of, this is all fine. If not, if our caretaker isn't consistently around, if we have no idea if our caretaker is going to come back or not, when they're going to come back, what we need to do to get them back, or if they come pay attention to us and they don't know what's the matter, then we start to have our nervous system that gets wired a little dysfunctionally. So this would mean that we're either hyper attached, as in don't leave, I don't know when you're going to come back, or completely detached, as in I don't trust that you're going to help me, so I'm just going to take take care of my own needs. Now that's an adult version, but it gives you some basics of what happens when we're kids. So our brain is meant to remember moments and emotions that are important to keep us safe and surviving. For example, remember that you are not good enough and no one wanted to play with you, preparing you to act or behave differently the next time. So our brain is meant to, one, connect. It's how we survive. We can't survive on our own. So we automatically want to attach to other people. And two, it remembers all the negative events that happened to us to prepare us for the next time, so we don't get caught off guard. Mental health. All right. When we, with our senses, see, hear, touch, taste something that reminds us of those memories, those unsafe memories, then our brain automatically reacts and goes, hello, remember that you felt rejected because no one wanted to play with you? Remember that you're not so cool, so that you can take care of your needs. So when incoming information gets translated by the brain as far as what it feels it needs to know, then it sends the information into the body so the body can act accordingly. So this is why we feel emotions, right? So that our bodies know what actions to take based on what we think is important for our survival or our happiness. If our emotion says that this is really good, we know that this is good and we're happy. If our emotion says this is not good, this is making us angry, then we know that we need to act differently or protect ourselves in some way. So when we have mental disorders, traumas, or a need to survive, our brain does not interpret this information properly from a realistic standpoint. So information comes in and we're thinking, oh, I have to remember they rejected me, they didn't want to play with me. When the reality is that might not have been the case at all, but our brain's remembering it. So then our brain over time begins to narrate those conclusions for us. And then we feel like we've got to be hyper aroused, or we get depressed because we feel like we're not good enough. Whatever those natural ways that our body narrates these experiences. So what's a personality disorder versus something else, like a disorder, like anxiety or depression? Personality disorders come in when they are part of someone's characters. So as we were just talking about anxiety and depression, right? Information comes in and then our brain interprets it, and then we get symptoms, which are episodes of our brain and our body reacting to such. A personality disorder means that these symptoms have actually become part of our character. So if you think about what your aunt is like, what your sister is like, what your father is like. You think about certain characteristics, right? They're nurturing, they're really nice, they're really driven, they're really witty, they're funny. These are characteristics. For somebody who has a personality disorder, it's become part of the brain function, and it becomes part of their characteristics for the personality. So when we are babies and little, we are in the care of our caregivers, our family. When we become adolescents, we start to test the world outside to see where we fit in. Are we smart? Are we social? Are we athletic? Whatever it is. So these characteristics, along with our other characteristics, come out like around adolescence. Sometimes we can be more flexible in these, like if we get around the wrong people or different people, we can act a little differently. So it becomes much more solidified and noticeable when we are in our teenage years. So that is how personality disorder is starting to become into the characteristics of someone. They learn that the way that they survive is by being hypervigilant to these things and being extra sensitive to these things. When we have a personality disorder, we see it in all aspects of our lives because it's part of someone's characteristics. Like when someone's really kind and nurturing, you see it, whether they're at home with their families, whether they're at work with their coworkers. It's the same way with a personality disorder. These go into the different aspects of life. So how does a personality disorder come about? And this is true with really most of the mental health issues. So we talk about a cappuccino, and I will go through how something comes and then how that ties into cappuccino in a minute. So genetics, right? So of course, everything is genetic, right? There is the underlying thing in your genes when you're born. When something happens or a multitude of things happen in your life, these genes get turned on. This can be trauma. This can be life situations. Most of the time for personality disorders, especially, it's caregiver traumas. It's not trusting that the caregiver will be around or consistent or know what is wrong with them. So we say that it's like a cappuccino, right? So the genetics is the coffee, right? The little espresso coffee. And everything that happens in life is like the milk, the frothy milk, right? And at the top, you get the cappuccino or the espresso. So it's a little bit of the coffee, a little bit of the foam, and then you get the whole experience. So that's kind of how epigenetics and how these things get turned on for us. Okay, before we go on, it is very important to know that our brain is wired to remember the things that we need to remember. Many times, right, our brain will react to these memories. This can include anxious attachment, which can look very similar to borderline personality disorder. If you look at the couples videos on my channel, you'll be able to get some more information about that and what that looks like. So just because you see some of these characteristics does not mean you have to race out to the nearest therapist or doctor and diagnose yourself with borderline. So anxious attachment, anxiety, trauma can all look very similar. Only 2 to 6% of the population actually have this. So it's not as common as you might think. So make sure if you start to see a lot of similarities and you want to talk to a doctor, that would be great, but don't make a self-diagnosis because it can look very similar to other things. Okay, so what does it look like? The most important aspect of borderline is the extreme reaction to real or imagined abandonment. These individuals are very sensitive of themselves and when others could leave them physically or emotionally, right? If they're worried about doing something or saying something and they're worried about love being taken away, then they create the fear, the extreme fear. And then it's the narrative that they're bad or they're evil or they're not good enough. See, if I was smarter, they would have stuck around. If I wasn't so stupid, if I wasn't so needy, if I wasn't this, they would be able to give to me. They would want to spend time with me. It creates the narrative of not so much what's happening in the moment, but the wound, the deep wound from being able to feel abandonment, from not trusting that our loved ones will stick through things with us and love us anyway. So when we have these moments, the reactions can be anger, right? Passive aggressiveness. Oh, okay, I see that your friends are more important than I am. Or it can be a borderline rage, which goes into full on fight or flight mode. I mean, you'll see like instantaneously this total amount of rage coming from anger and fear and guilt and shame and all these things. And it can get very aggressive. People can punch things or throw things or whatever. Or impulsive behaviors, right? They feel so badly that they will reach out to an ex-boyfriend to make them feel better. Or, a lot of sex addicts will try to find the nearest person to have sex with, or they'll get in the car and go 90 miles an hour on the highway, or binge eating. With somebody with a lot of trauma, you'll see dissociative states where they'll just shut down. Their brain, it's so painful, their brain can't even really function. So it just goes into a freeze state. So we know that this is a personality disorder when the reactions are extreme and don't match what's happening. They're reacting from the wound and not from actually what is information that's coming in. So, for example, believing your partner does not love you or does not want to spend time with you because they're playing video games or spending time with their friends, right? So from a logical perspective that they're relaxing, they're having, time with their friends, whatever it is, but you feel very abandoned. You feel very anxious about it. You feel very insecure. You feel like it's your fault. And addiction can be a really big thing that gets used with these things because it helps kind of medicate and normalize if they're drinking or they're doing drugs. So this becomes a pattern of behavior to help them feel more normal. And they have a hard time with long-term relationships and friends and jobs because they get so reactive that they push people away or they don't trust people. And so you'll see a lot of interpersonal relationships being broken. Okay, so what are their other characteristics? And this is more in like the real world. So spending time with someone who they're in a relationship with, and that's like all their time. Like you rarely see them apart. They don't really have a lot of their own goals or hobbies. They're kind of like getting into whatever their partner is. They share intense information with someone in the beginning. It's like, love me, love me, love me. I want you to know everything about me so that you have to be bonded to me and then you're never going to want to leave me. Tattoos. Pete Davidson has said publicly that he has borderline, hence the fact that he has tattoos of everyone he ever dates. I believe he just got some tattoos of Kim's children. So that's a sign of borderline. It's like this intense attachment. The other person is either worshipped or believed to be totally evil. It's fluctuating depending on what the other person's doing. This comes from not having a sense of the self. And so it's not about what's happening. It's about the person is amazing and perfect. And then when they do something that hurts the person's feelings, they're just so awful. He's so mean. If he loved me, if he wasn't so awful, he wouldn't treat me like this. And then it goes into this person is evil. We call it good object, bad object, because borderline is about the other person, not so much about the self. They often feel empty and there's a big risk of suicidal ideation or attempts with people with borderline because they don't really have a sense of themselves and they're feeling constantly like a roller coaster emotionally. Okay. So in borderline, what are ways to help? So one is medication, right? Some people give antidepressants, but it hasn't really been shown to be extremely effective. Mood stabilizers does help because it helps kind of navigate the mood so it doesn't go up and down so much. Therapy is really important because it's so important to know what the triggers are for the person. It's important to know how to manage these emotions. It's really important to be able to navigate what is real in the moment is what is not. Right? Someone with borderline can say, okay, my boyfriend just wanted to play some video games. I got really upset, but I know it's not real, right? And that's how you continue on with a relationship is by being able to manage these things. And then DBT is a form of therapy that was created by Marsha Linehan specifically for these very intense emotions. So she talks about being grounded, and she talks about being able to be in the moment, to experience what it is you're experiencing. When we can recall the emotion that we're experiencing, we can then figure out what it is that we need, and we can communicate that either for ourselves or to other people. When we react out of communicating what we need on a deeper level instead of an emotional level, then we're more likely to get the responses that we want, or we can navigate those better. So it teaches us how to respond versus react in those moments. She talks about going into the wise mind. So wise mind meaning it's not emotional, it's not all logical, it's somewhere in the middle where you can make an emotional decision based on all the information above. Okay. Narcissistic personality disorder. That is also very big in pop culture right now. So I wanted to go over it. We often believe that when people are acting selfish or not caring about other people, we go, oh, they're such a narcissist, right? Oh, I think this person's got narcissism, right? It's all over the place. And I think it's amazing that we have this new self-awareness about it, because it really does help us to protect ourselves against these interactions. However, not everybody has narcissism. Again, it's not a big part of the population. So how do we know if it's a narcissistic trait, right? If it's someone who's just really learned to just keep going and protecting themselves to survive, or if it's actually the personality disorder. So we say the same thing from borderline, is that it's genetic, right? So usually there's caregiver trauma, right? Usually there's a parent who didn't let them feel like they were loved or safe, or even that they were valid in what they were experiencing. The goalpost for love and affection kept moving. So they couldn't figure out who they were, right? When I smile, other people smile. They don't get that because sometimes the caregiver smiles and sometimes they don't. So they lose that sense of self and how to be able to navigate relationships and situations. Also, they say that borderline really starts around 2 years old, and that's when the trauma happens in the brain. So in narcissism, it's when you're about 4. So again, you'll see these people getting into like temper tantrums because they never really learned how to activate these parts of the brain. So when the genetics are turned on based on the situation, the environment, the caregivers, if there's trauma, whatever it is, then that becomes how they live their life. Again, this is part of their characteristics, not just symptoms. Okay. So like I said, when we're coming out of a toddler and we start to figure out who we are in the world, these people do not have a sense of themselves. There is no basic sense of who they are. So what happens is they start to see who they are based on interactions from everybody else. So when we are acting like a good coworker and people are happy with us, all right, we put on that mask. That's what looks good to the outside world. When we're in the father role or the mother role, right, we see, okay, when I do this, I get positive interactions. Okay, so that's what it looks like to be a good mother or a good father, right? They have all the value that comes from the outside. They don't have any sense of themselves. The sense of the self is a completely blank canvas, right? So all they know is what's being seen to them. So they just put on the different masks, right? They go out into the world and they dress really well and they have fancy cars because that shows them that they're successful because people react to that. So they act that way. And they also have pretty flat emotional experiences. So therefore, not a lot of empathy for others. You'll see people with narcissism in a situation where they should be crying or they should be sad, like crocodile tears. They don't really feel the emotion very deeply. So diagnosing. So you'll see that people with narcissism personality really only talk about their pain and suffering, right? Because when someone isn't doing something, giving them accolades, giving them affection, giving them admiration, they're like, what? Why wouldn't you be giving? I'm amazing. And this is how it's all they know. So they talk about themselves, especially when people are not giving them that adoration. They don't really understand the pain of others. So they'll sit there and smile and nod and pretend like they're listening, but they're not really understanding it from an emotional experience and why they should feel sorry for somebody else. So like I said, they need excessive admiration. Remember, there's no sense of themselves unless somebody else is giving it to them. It's just a flatness. Their grandiose sense of themselves, their achievements, and their statuses, they like to tote a lot, right? Like, again, that's how they're like, oh, look at me, I did this. Like, that's how they find their value. Believing they are special. When they believe that they're special, they believe that only other special people will understand them, which means if you're not on what they consider a level, they can't really be, it's not worth their time or their energy to deal with you. Because if a special person is giving them accolades, then that gives them value. If someone who's not, it's like, oh, I could care less, you're a peon. It's not important. Sense of entitlement. They believe in unreasonable expectations of others, just like we were talking about. It's a sense from other people of having to always tell them how amazing they are. Because the empathy and emotional experience is really only surface level, they feel no guilt about taking advantage of others. Again, they think everybody else has the same emotional flatness that they do, so they don't feel guilty about hurting other people. Okay, one last point. We know successful people can show these traits, so sometimes it's confusing to know the difference. We know it's reached a personality disorder when they are inflexible, and despite causing deep problems in all aspects of their lives, they are still very rigid in this way of being. This means that very few of them tend to come to therapy. They don't see it as a problem. So if you are asking if this might be you, then you're probably not. So recap. Borderline personality disorder means they are extra scared of having loved ones leaving them or rejecting them, believing if they do something or don't do something, the person will no longer love them and that love will be taken away. They have little sense of themselves to navigate their likes, dislikes, and internal goals. Narcissism means that you see your value reflected in others. The sense of the self is an empty canvas. There's nothing there. Actions are only induced by the mask they're wearing in any given environment. So thank you for joining me. I really hope that was helpful in helping you figure out the whole Amber Heard Johnny Depp situation. If you have any more curiosities or anything that you want to know more about, email me. I love when people are curious about something. I feel like it's my gift that I get to experience these things. And I think that it's really important as we navigate ourselves and our relationships and the people that we come across, that we understand the different dynamics so that it helps us prepare for ourselves and for what we want in life. So email me if you have any more questions or concerns about this or any other topic. Have a wonderful day. Bye.